midwife Marley. There we are. I know. I have it this way for
there we go.
for YouTube.
Is that better? Okay. There we go.
Yes.
I was expecting it to be around the other way. I was expecting it to be vertical. Sorry.
Well, no, it typically is on Instagram, but because of YouTube, we're going to record this and put this on YouTube. YouTube is horizontal. So, and I turned off commenting so that we don't have the text on our faces.
Right. Okay.
All right.
I hope it looks like I'm looking at you in the eye, because where my camera is,
I know. Don't worry about that. I haven't figured that part out yet. So just look wherever you want to look. It's fine.
Okay.
So it's so nice to meet you, midwife Marley. I'm Jeanice Mitchell, a pelvic therapist in the U.S., and I've been following you for a long time. I love your content.
Hi. Yes, I love yours too. All things pelvic floor. Fantastic.
I know. So please just tell us a little bit about yourself.
Well, so my name is Marley, and I'm a midwife from the UK, which you already sort of said. I've been a midwife for 10 years, and I think people get a little bit confused about what a midwife is over here, because I think it's a lot different to what it is in the United States.
Okay.
Anyway, I trained as a midwife 10 years ago when I had my son, who was 5 at the time. He's nearly 20 now. He was 5. And then halfway through my training, I decided to have twins. So I had twins. And then I took a year out. And then I completed my degree and became a midwife. So
lovely.
And that's what I've been doing ever since. So it's fantastic. But I work in all areas. So we work with women antenatally or prenatally. So I do clinics and things, and I see them, throughout the pregnancy. I look after women through the birth. And then I look after women postpartum as well. So it's kind of, we see them the whole way through, the whole experience.
I love it. I love it. That's wonderful. And just a personal note, I also have a son who's almost 20. So we have some similar ages there. And I have a daughter named Marley. So how could I not follow you? Yes.
Oh, wow. Fantastic.
Yes. So that name has a special place in my heart.
Oh, that's fantastic.
All right. Okay, so let's jump into this. We'll go over some questions, and then the audience has some questions. We'll cover as much as we can in our time period. And if we don't get to everything, it's okay. So, and everybody here, thank you so much for joining us. All right. So how long does it take for your body to recover from birth? The question.
Oh, yeah. That's $1 million question. And funnily enough, I actually had a DM, it was yesterday, I think it was yesterday, asking me about that. Well, what I'll say first of all is it varies from woman to woman. Everybody's bodies are different, and women who are fitter, or who've been going to the gym on a regular basis. You get some women who are hardcore. I'm not one of them, unfortunately. I wish I was. I wish I was. I don't have the time for the gym.
And the discipline. Yeah, it does take a lot of time. It does take a lot of time.
Yeah, it does. It does. But you see some women who appear to bounce back very, very quickly, but just because that they look like they've bounced back on the outside and there's no belly there anymore, it doesn't mean that inside everything has recovered, because obviously being a physiotherapist, you've still got your pelvic floor to be concerned about, and there's lots of things going on, and hormonally as well. So I say to women, look, the length of time your pregnancy is taken, the pregnancy is taken 9 months. Give yourselves at least 9 months to recover from the birth of your baby. Sometimes it's even longer, and that's why we say to women, wait at least 9 months to a year before you think about having another baby. And then when women are breastfeeding, this is why people who exclusively breastfeed, they don't ovulate, because it's your Mother Nature's way of saying, hey, let's recover from this baby first before we start, going for another one. Yeah. So yeah, I would say 9 months to a year, but it varies from woman to woman, really.
Okay, good. And so what are your recommendations on when a mother should first go out of her house after you give birth? Because there's varying schools of thought on that.
There is, and I think there's no hard and fast rule, really. It varies from practitioner to practitioner, from person to person. Midwives, older midwives that I know, midwives that
cover them up.
staying for 40 days. You know, that trained back in the 70s, the 60s, 70s. Back then, it was normal to stay in hospital for 10 days. You know, stay in hospital for 10 days and then come home and then don't go out for a further week after that. But I think as time's gone by, we know that if you stay immobile for too long, then that increases your risk of developing blood clots and things. But I think a lot of women also worry about baby picking up, you know, viruses and things like that. But I say to women, stay at home for as long as you feel comfortable. You know, if you've had a cesarean section, you're going to be in hospital for a few days and it's going to be difficult to walk. So, you know, take a few more days at home. But then you've got people who have had children as well and have got to take children to school and things like that.
Yeah, you have to live.
Yeah, you have to. I mean, I remember doing the school run after I had my cesarean. I think on the third day that I was out of hospital, you know, but I had to do it. And not that I would recommend doing that to anybody. But I think listen to your body. Listen to your body. If you feel that you are exhausted, you're finding things difficult to move and walk, give yourself time. So it may be that you might want to go out after 3 days. It might be that, you know, it takes 6 or 7 days before you want to go and venture out and about. But kind of listen to your body and make sure that you're well supported as well. You know, make sure that you've got kind of support from family or friends as well.
So important.
Everybody's different. You know, there really is no hard and fast rule on when you should go out at all. But you know, try not to give yourself cabin fever by staying at home for a month, because I think that's enough to drive anybody insane.
And exercise, do it. Even just gentle walking is so important for the recovery. So. Right.
It is, absolutely.
And your mind, it's good for your mind to do that too.
And also what I say to women is, when I say go out, it doesn't mean you have to go out on a day trip. You know, you can just get your pram or your buggy or pushchair, whatever you want to call it, stroller, and just go for a 5-minute walk. Sorry, because I'm
it was
British.
pram. I want to hear it again. Pram, push chair, and buggy.
We call it a pushchair. Yeah, I don't know, but you guys call it a stroller.
A stroller. It sounds so boring next to those cute little names.
But you know, you might just want to go out and take the baby out for a walk for 5 minutes. You know, just see how you do going down the road. You don't have to go out on a day trip for the first.
Good, excellent. I love it. Okay, so any tips for the first 2 weeks? So we just had our baby and we're home, and it's our first baby.
Oh gosh, yeah. One, expect the unexpected. So I think all babies are different. All babies are different, and all mums are different. You know, we all recover differently postpartum. You know, some women, it's like women who have cesareans. You know, some of them are like, it was no big deal. I was up on my feet walking around within 24 hours. And other women, like me, you know, I'm still hobbling around after 6 weeks, you know. So just remember that everybody is different. I'm not going to sit here and say sleep when the baby sleeps, because we all say that, and it's easy for us to say.
So easy
very, very difficult to do.
Yeah.
It's very difficult to do because, you know, there's things you want to get done when the baby's asleep. All I can suggest is try to get as much rest as you can, you know, whenever that is or however that is. With visitors as well, you know, some people are very, very happy to have lots of visitors over, which is great. But if you do have visitors, put them to use, make them useful, you know. You know, they're coming to visit you in your home. You shouldn't be expected to be running around catering for them and making them drinks and stuff. You know, it should be them kind of coming to help and support you. So put your visitors to use as well.
I love it.
And and just remember that whether you are breastfeeding or bottle feeding, you're going to be feeding that baby regularly, and that's going to be all through the day and all through the night as well. So if you can try to mentally prepare yourself to be exhausted the first couple of weeks, you know,
I remember just thinking, this too shall pass. This too shall pass. Make it to the morning. Make it to the morning. And when that sun would start to come up, it was the most beautiful sight.
I know, but it's like when you've just had a baby, it's an hour by hour process, isn't it? You've kind of got to get through the hours. And
be patient with yourself. Don't be so hard. I think we have so many expectations of how we need to do things, and so I love just the patient, gentle approach, and move, but rest too. You need both, and put your visitors to work.
Yes, and also one thing I will say is, don't be surprised if after a few days you burst into tears over nothing. You know, or you think it's nothing, but actually your hormones are trying to regulate themselves.
Yeah.
You've had lack of sleep. It's been overwhelming. You've had adrenaline running through your body because you've just had a baby. So you've probably been awake for days and days and days. And all of that can come crashing down after a few days. And you think, oh my goodness, now I'm responsible for a little person. Everything can become a bit too much. And that is quite normal as long as it's short-lived. You know, you might be like for a couple of days. If it goes on for longer than that, then that'll be a time to then maybe speak to either your midwife or your doctor or nurse or whoever it is that's looking after you. Yeah,
that's great. Okay, so how do you care for women postpartum in the UK? I'm interested to see how it's the same and how it's different. That I'm in the US, for anyone that doesn't know that already.
Okay. Yeah, so over here, midwives, we work in hospitals mainly in hospitals. We do, some women work, midwives work privately and do home births and things, but majority of midwives work in hospitals. So we are basically like labour and delivery nurses, but we deliver the baby as well. Okay. So we do everything and we deliver the baby. So as part of the package of care, what we do postpartum or postnatally, as we like to say, is the moment they've gone home from the hospital, we then visit them at home the following day. So the day after they've come back.
Oh, you go to their house.
We go to their house, yes. And we make sure, so we check the mum over to make sure she's not bleeding too heavily, make sure she's feeling okay, make sure her breasts aren't, too painful or anything, make sure she's mentally feeling okay, she's supported. And then we check the baby over, make sure the baby looks okay and that we haven't got any concerns. And it's just like an introductory visit, really. Yeah. We see the mums again on day 5 and day 10. Years ago, we used to visit them at home on day 5 and day 10, but because our population is increasing, we just can't. How can you do
that? There's not enough of you to be able to go.
No. So what we do is the women that have had normal deliveries with no complications, we ask them to come to one of our postnatal clinics on day 5, because we feel that most women by day 5, as long as they're okay, should be able to come out of the house. But if they're not, if they're feeling really rough or really unwell, then we will, go and see them at home. Okay. But if we try to get them to come to a postnatal clinic, and at that point there, if she's had a cesarean, we then remove her stitches. If she hasn't, we might check her perineum to make sure that any sutures that she's had are healing well.
And
we also weigh the baby day 5, okay. And we weigh the baby on day 5 as well. We don't weigh the baby before that, because all it does is just scares the mums, because baby will always lose weight in the first 5 days. So if you weigh any earlier than that, it just gets mums thinking, oh my gosh, baby's lost weight and I haven't got enough milk. So we weigh babies on day 5. Okay. And then, we see them again on day 10. And if everything's okay on day 10, we discharge them to the care of what we call a health visitor. The health visitor is a registered nurse, and she is attached to a baby and the baby's family for 5 years, up until the child starts school.
Really?
So what they do is they do all the developmental reviews over the years. They do if the mum wants any immunisations or vaccinations, then that goes through the health visitor. Any problems with anything at all over 5 years, then the mum will go to the health visitor. So we hand over the care at day 10. Okay. To the health visitor.
So does the health visitor go to the home? Do they visit in the home, or
yes. Yes, they usually do 1 to 2 visits. They do a visit after day 10. So after the midwife's been, the health visitor will go round and she'll bombard the mum with lots of information about absolutely everything, like local clinics, local mother and baby groups, immunisations, developmental checks, absolutely everything. And then she may well come back again after 6 weeks just to check that everything is okay. And it's a good way of for us, safeguarding as well, to or child protection, as it were, because it kind of identifies if there's any issues very, very early on with any families. So staying connected with that family is a way for them not to get lost in the system, and just be there and be supportive as well. So if there's any issues that come up with the parents over the first few months, and the health visitor can be there to kind of help them and guide them in the right direction.
That is fantastic. So the health visitor is also checking the mom, like it's not so much.
Not really. I mean, the midwife is mainly for the mum and the baby. Okay. The health visitor, she will check in the sense of mental health. So she will do a screening for postnatal depression.
Yeah, make sure she's safe.
But she's more there for the baby. Really. Okay. She's there for the mum as in a supportive way. But she won't do any like physical checks or anything like that. After that point, if there's anything physically that the mum needs, then she needs to go to the GP, which is a general practitioner or a doctor, the family doctor, to get some support and some advice there.
Good. So I'm going a little off track here, but it's fascinating. It's such a different model, and it sounds amazing.
It is.
So at what point are the moms educated in terms of some of those guidelines? Because I know you have a really strong, the NICE guidelines, right? That talk about urinary leakage and postpartum prolapse and that kind of thing. So at what point are moms kind of educated on that, hey, these are warning signs, or we're just trying to get the word out? Or is there any specific time point that is a great, place for that to happen?
Yeah. I think when the midwife does her first home visit, so when the woman comes out of hospital and the following day when the midwife goes around to see her, at that point, then she will say to the mum, we always talk about the pelvic floor. We always talk about pelvic floor exercises. One of the questions that we ask, because we have like this care plan and we go down the list and we ask, are you eating and drinking? We check the uterus to make sure it's contracted. Are you going to the toilet okay? Are you passing urine okay? You're doing your bowels, blah, blah, blah. And at that point, if a woman says, oh, yes, but, leaking a bit or whatever, we talk about pelvic floor and we tell the women what's normal and what's not and when to kind of reach out for us if there's any, any concerns.
That's good.
And we say to them, even the ones that aren't suffering from any incontinence at that time, we say, look, it's so important for later in life, when you're older. Obviously,
prevention. Prevention.
Yes, absolutely. Yeah.
So like in terms of here in the US, ideally at that 6-week visit, because we don't generally see a provider until 6 weeks postpartum, unless there's a problem. Nobody. Like once you have your baby. Well, you'll see a pediatrician, but you won't see, like for the mom.
So who checks on the mum? Like if she's had stitches, who checks to make sure they're healing okay, or the cesarean section wound? Who kind of looks at all those things?
Well, so they must. So for a C-section, I think it's a little bit of a different care plan, but for a vaginal delivery, you're not going back in until 6 weeks. And that 6 weeks, like ideally in our mind, like the therapy world, we would love for every provider to be able to talk about, like ask, are you having urinary leakage? Are you having pelvic pain? Are you having prolapse? So that's in an ideal world that providers are asking that, but we're just trying to get the word out there. So there are definite
6 weeks
challenges.
Is quite a long time, isn't it?
It is a long time. It's interesting. It's very, and I can't say that that's the case everywhere, but that's the general. So
right.
Okay. Very interesting. Okay, so perineal care for postpartum women.
Perineal care, right?
Tips.
Yes. Okay. So, really, I mean, at the moment we are. If there's different gradings of tears, so you've got this 1st degree tear, you've got your 2nd degree tear, you've got your 3rd degree tear, 4th degree tear, and the 1st degree tears are the most common, and they are where the skin has been torn a little bit. It's just like a little cut on the skin, and usually we don't put any stitches in, we don't put any sutures in at all, we let it naturally heal itself. Most women are okay, and within a couple of days they feel fine. Sometimes it can be a bit stingy, can sting a little bit, especially when you're going, for a wee, going to the toilet. But what I say to women is just keep it clean, keep the area clean, try and shower if you can in the morning and the evening, and then just pat it dry gently, before you put your underwear on. Change your pads regularly. Bacteria can grow very, very quickly. So just keep the area as clean and as dry as you can. Try to refrain from putting anything on it. Just keep the area totally clean. You haven't got to put loads of ointments and lotions and potions and things like that on the area. It needs air, to dry and to heal. What you'll probably find is if you have sutures, if you have stitches, that after about 4 to 5 days, that the area becomes very tight and it's quite sore, and all that is the sutures basically joining the skin together. So it's a good sign. It's a good sign. But if you have any severe pain at any point after you've had your stitches put in, then you need to let your care provider know. Moving around as well, if you've had a second, third or fourth degree tears aren't very common, by the way, but if you've had one, then just be careful when you're moving around. That would be a time when I'd say don't rush out the house too quickly, or if you do, just go out for a gentle walk, very, very slow walk, you know, maybe just to the end of your road and come back again. Don't do anything too strenuous, because you don't want to kind of hinder the healing process. Take regular analgesia if you need to. Over here we give paracetamol and an ibuprofen or Nurofen. There was one more thing I was going to say, actually. Oh yes, if you've had a 3rd degree tear or a 4th degree tear, which again are the least common ones, then you may find that you struggle to empty your bowels. You struggle to go for number 2. Some women are scared of going as well. They think, oh my gosh, if I go to the toilet, it's going to rip all the scars open. That won't happen, but it can be uncomfortable. So you may well be prescribed some laxatives, or if you don't want to have laxatives, just drink plenty of water and eat plenty of fibrous foods and fruits as well.
Yes, that's so important. So important.
But the main thing is just to keep the area clean, really.
Yeah. Something I have found very helpful too is, especially for that first one, wrapping your hand in toilet paper and just gently applying some external pressure to the perineum to support from below. You don't want to strain. I mean, we're doing the water, the stool softeners and so forth to keep it loose if possible. But you know, there's going to be some downward pressure, and so just gently. You don't want to push really hard, you know, because that's going to counteract and that's going to be painful. But you want to just gently apply some upward pressure.
Because you get that heaviness, don't you? It kind of feels really heavy down there. Like you think, oh my gosh, everything's going to fall out. Yeah, exactly. But it's not. But it's just that's how it feels. So yeah, absolutely. Applying a little bit of pressure, you know, would be a great help.
Yes. Okay. So now, any tips for dads to support postpartum? What would you say for the birth partners?
Right, so dads, there's a lot that dads can do, and I think that many dads feel a little bit helpless, you know, a little bit left out, especially if the mum's breastfeeding. But it's important to know that there are lots of things you can do to bond with your baby and get involved with your baby. You don't have to be feeding the baby, which I think is a very, very common misconception, you know. So what I would say is, you know, make sure that mum has plenty to drink, make sure that there's food available, try and take the chores off of her hand as well, get things in place so that when she comes home from the hospital, there isn't any washing there. There's no washing up, you know, there's no dishes on the side there, you know, there's nothing that needs to be done. Okay, make sure that there is some maybe even if you can cook a dish or have some food ready for when she comes home. That would be fantastic. And also just understand that she's going to be up and down with emotions because of tiredness, because of hormones, and just to try and kind of be as understanding as you can.
Don't take it personally.
No, don't take it personally, because it's a very, very short-lived phase, you know. It's just like when you're giving birth and you start cursing at people, and then the moment the baby comes out, you're like, I'm sorry, I didn't mean to do that.
I still love you. Do you still love me?
Yeah, exactly. So don't take it personally at all. But just remember that the newborn baby is going to be the focus for both of you. You know, that's going to be the main focus at that particular time. It's not always going to be like that because babies grow older, you know, but just remember that her time is going to be taken up quite a lot by the baby. Doesn't mean she loves you any less. And you know, and just sort of try and be understanding to that fact, really. And if, you know, she needs to have a shower or she needs to have a nap for half an hour, just be prepared to kind of take the baby and just rock the baby around the house. Yeah, keep the baby close, just so that mum can get a bit of rest, because it can become very, very, very overwhelming, you know. You know what it's like.
I love it. Yes. And lift. She does not need to be carrying the stroller, the baby, the car seat, the diaper bag, her giant purse. I mean, just think, you know, I'm coming from the pelvic floor. I'm the pelvic floor. And think about how much pressure that's putting on the pelvic floor.
Well, we say that really, in the first few days, mum shouldn't have to be carrying anything heavier than her baby. You know, baby's what, a couple of kilos. That should be enough, really. There shouldn't be any other heavy lifting going on there.
I agree. Yes.
Yeah.
But I think so many, I mean, I don't know that that is a standard recommendation. I hope that it is. I don't remember hearing that. And I think even if it is on that list of things that you get when you leave the hospital or your birth center, are you going to remember that? And we try to be like super moms and trying to do everything. So just again, be patient, allow your body time to heal. It's done so much, whether you had a vaginal delivery or C-section, you know, went through a lot.
And I think, you know, we look after women when they're pregnant and we say, oh, don't carry that, don't do that, don't do this. But we kind of forget that postpartum.
Hey, you're done.
Oh, okay, you're okay now. Well, actually, no, you need time to recover as well.
Yes,
you know?
So let's talk about the fourth trimester. Perfect timing. So what is the fourth trimester?
Well, the fourth trimester is a phrase that's been around for a little while. And basically, it's from the birth up until the baby's 3 months old. And we use it to describe the transition that the baby makes from the uterus into the outside world.
Okay.
And the reason we kind of call it the fourth trimester is because the baby's going through a lot of changes, and it kind of helps women to understand why a baby is clingy and crying all the time. And because I think a lot of people kind of expect, well, the baby's just born, and I put it in a basket and it just stays there and that's it. No. That baby's been growing in your womb for 9 months. That baby still wants to be close to you. So, and I've got 5 children. Not a single one of them has been happy with me putting them down, you know, and I've had them stuck to me. And I've had to say, look, you know, to my other half, can I have a shower now? Can you hold the baby so I can go to the shower? And I'll shower, come back, take the baby back. And it is like that for a little while. It's not like that forever.
No.
But it's just understanding that your baby is trying to transition into the outside world, and that it takes a bit of time. And usually by the time the baby gets to 3 months old, and sometimes earlier than that, but we usually say by 3 months, things should be a lot easier, you know. Baby should be a lot happier with being, you know, put down for a certain period of time. But just remember, you can't spoil a newborn baby. You cannot spoil them. So don't let anybody tell you otherwise.
Love them.
Absolutely. Hold them. And if your baby is crying, pick them up.
There's no reason not to.
Exactly. And they either want food, or they want to be held, or they, you know, want to be cuddled. They just want to know that you're near. It's an instinct for them. So it's just appreciating that they are making this transition into the big world. And it's not easy. It's difficult for you, but it's not easy for them either. You know. And they're getting used to night and day and things. Usually by the time a baby's a couple of months old, 2 to 3 months old, not many are sleeping through the night, but they have a better understanding of day and night time, you know, so you find for longer periods at night. So that's why we call it the fourth trimester. And by that point, you as a mother should be used to it, kind of used to being a mum, used to your baby, and you know, and ready to move
past the fourth trimester. Okay.
Exactly.
You know, somebody told me something. I think it was an OB nurse about when I had my first baby, and I think that I just want to interject this as well. So you're at home and you're in the fourth trimester and you're alone. Okay, so let's say you have no support and you are exhausted, and the baby is fed, the baby is dry, the baby is fine, but the baby is crying and you are at your limit. It's also okay to put the baby in the crib and to step away too. You know, crying babies are not going, you know, it's not a sin for the baby to cry. We do want to comfort the babies, but if you're at your limit and you need to just step away, it's okay. So
absolutely. And I think most of us have been there as well. I certainly have. I've certainly have.
Like, okay, you know, I've done everything that I can, and I just have to step away for a minute.
Absolutely. And stepping away for a few minutes is not going to be detrimental to the baby. And what I'm talking about is leaving a baby to scream for an hour. Or scream. I mean, but you know, I've come to the point sometimes with a few of my children actually, when they've been little, and I'm thinking, I can't do anything else, Steve. Right, I'm going to just put you down and I'm going to walk out.
Exactly.
Because
just
you
take a breather.
need to calm down. You need to calm down, go downstairs, get myself a glass of water, relax, and then I think, I need to go back up and get her.
Exactly.
I can't give her crying anymore.
Exactly. And there isn't one set, you know, right and wrong in every situation. So you have to determine. But ultimately make sure you're safe and the baby's safe, and if the
Absolutely.
baby cries for a little while, it's not the end of the world. Make sure the baby's safe. So good.
Yeah.
Okay, I just wanted to make sure anybody out there listening, that I don't want them to feel bad if their baby cries.
No.
Okay.
No, absolutely.
So I know you have some memorable experiences for caring for a woman postpartum. Share, please.
Yeah.
Any interesting stories? I mean, I'm sure every person is interesting in one way or another, but does anything stand out?
Yeah, a couple actually. A couple of them do stand out. One in particular was a lady who I went to visit. I can't remember how many days she was. She was probably about, I think she was about 5 days. 5 days post. Actually, maybe not even 5 days. 3 or 4 days post cesarean. And I went to visit her at home, and unfortunately, due to errors on our part, she hadn't been visited yet. So she should have had a visit the following day,
right
after the hospital, and she hadn't. So obviously, you know, management were going up in the arms and, oh my goodness, this woman hasn't been seen. Go around and see her quickly. So I went around to see her, and she was lying on the bed. She couldn't move, which was unusual for someone who was 3 or 4 days, you know, post cesarean section. And she was crying, and I said, what's wrong? And she said, I can't move. I'm in absolute agony. I'm in so much pain. And I said, what, where, what, how? She said, my scar. So I thought, oh my goodness. So anyway, so I had a look. I took the dressing off, and there was, and this is rare, by the way. This isn't, I think this is the first time I've ever seen this in 10 years. So it's not something that happens to everybody. But she had this a hematoma on her, which is basically a collection of blood on the scar. So the scar should have been flat, and it was actually like this big lump. And I thought, oh my goodness, you poor thing. So I said to her, okay, well, we need to get you back to the hospital, because that looks like it's going to have to be drained. And she couldn't move. She could not walk at all. She couldn't move. So I ended up having to call an ambulance, because we were going to take her in her husband's car, but I had to call an ambulance. The ambulance didn't come, and I was sat there with them. They refused to come, first of all, and it took me about 3 or 4 phone calls to the ambulance service. And then in the end, I called them back and demanded that they send somebody now. And I was with her for 6 hours waiting.
Oh my word.
We finally got her into the hospital, and they drained something like half a litre. No, maybe not half a litre, it's probably quite a lot. But it was about 300 mils of blood from this hematoma that had collected around her abdomen. But afterwards, she was absolutely fine, and you know, she went home. But that is a story that really, really, really does kind of, you know, does stick in my mind. I mean, there's lots of them, and there's lots of stories that kind of stand out, but a lot of them aren't so
dramatic,
aren't so dramatic, or aren't particularly happy ones either. So I don't want to sort of go down that road. But most women are absolutely fantastic. I had one lady once who came to the clinic postnatally, and she'd had a natural birth, and she was, I think it was about 5 days after she'd given birth, and she had natural delivery, and she would basically sprung up with this baby and with her 5 other children. She was like, you would not think she just had a baby. And I was like, oh, just slow down. She was almost skipping into the clinic, and she was absolutely fantastic, and she was just so fun. I was like, no, are you sure you're okay? Do you need any support? Her, no, I'm fine. She totally hadn't. And I said to her, yeah, but you know, you need to sleep when the baby sleeps. And she just looked at me and said, oh, come on now, how am I supposed to sleep when the baby sleeps?
Look at all this that I have.
So, exactly. So I said, okay, all right, fair enough, we'll leave that one now. Yes. Every now and again we do get a memorable client that does stand out to us.
Yes. Okay, now we're going to jump into a few of the questions that we got from the audience. So how long does a 2nd-degree tear take to heal if a stitch popped? So I'm sure that it varies somewhat based on the circumstances.
Yes, it does vary from woman to woman. I've looked after a woman before whose one of the stitches came out, and the wound was kind of open for a bit, and we actually visited her for a month until it actually started to heal properly. Yeah. So it's, you know, it can vary from woman to woman, but I would say most women probably a couple of weeks, no longer than that, really. Yeah.
I had an experience where I had a patient that was referred to therapy for
Mm.
pain with sex, and upon examination, the perineum wasn't closed. Like, so, and that's several months postpartum. So,
Yeah, so we have to be so careful.
I think, yeah, I don't know where the fail, and I'm not sure where the breakdown was in that scenario, but at that point I sent her back to her doctor. It was like, you know, we need to get that closed up.
Yeah.
We need to get it closed up.
Yeah.
So that highlights the importance of looking at yourself, because she didn't know. She was just having pain, and she's trying to have sex, and it's painful. Well, yeah, it's going to be painful if your perineum isn't closed all the way. So, which is
one of the reasons why we see women postnatally for a couple of weeks after they give birth, because we can check the perineum, we can make sure that it's healing up okay.
Yeah,
you know, because otherwise, who's to know?
Right. Yeah. Okay. What about subsequent pregnancy after a prolapse? So you have a prolapse. What do you say to people that want to have another baby?
What are we saying is prolapse here? Prolapse what? A prolapse uterus?
It doesn't say it. Let's say a bladder. Let's say, but honestly, let's say a bladder or a rectum.
Okay. Gosh, I mean, I'm not an expert on that, to be honest, because I would presume that somebody who's gone through any kind of prolapse like that would be, one, referred to a gynecologist, and secondly, they would be referred to a physiotherapist as well. I would have thought.
Yeah.
My best guess would be at least a year. I mean, you know, you need time for that to
you need to recover from below.
Yeah, absolutely. So I wouldn't even be dreaming of even trying to get pregnant for at least a year after having a baby if I've gone through some kind of prolapse. And even then, to get signed off by your doctor and to make sure that everything is okay before you go trying to have another baby.
Yeah, doing everything that you can to recover and to prevent further descent, and to heal that tissue, strengthen that tissue as much as you can. But yes, you can have another baby, because I think this question was more like, is it a bad thing to get pregnant again if you have a prolapse? Well, I mean, look how prevalent prolapse is, and most women with prolapse don't have symptoms, you know. So in general, yes, you can get pregnant again. But you want to do as much as you can to support the perineum and to avoid straining and stress. You're going to have strain and stress on the perineum, because that's how we're designed, right? So you have that intra-abdominal pressure, but counteracting the forces. So being able to manage that pressure and learning how to do it well. So make sure you recover, and then have fun and have another baby.
Yourself.
Exactly. Okay, tell me, we're just wrapping up here. Thoughts on perineal massage during pregnancy, and then also during labor. What, you know, especially you being a midwife, what is your take on that?
I'm a big advocate of it, actually.
Yes!
More so during, not so much during the birth. Sorry, I don't know if you can hear. That's my baby's just woken.
It's okay. Do you need to go?
No, that's okay. I'll answer this question. It's fine. My other son's in there looking after her for a minute. So, but perineal massage is absolutely fantastic, and I do believe it does help prevent tearing through the birth. And that's not just, I mean, my personal experiences have been just that. I've had 3 natural births and never torn with any of them.
Ooh, wow.
I practiced perineal massage with all of my babies, and had very quick births as well. And but other women that I've recommended it to have come back to me and have said to me, oh, you know, I didn't have any tears, or I just had a first degree, just had a little first degree tear that wasn't sutured. So I do recommend it. And there are some, and there have been a couple of studies in the UK that have actually shown, you know, that it can help to reduce pain.
Yes,
louder and louder.
I know. Yes, so we'll wrap up. But yes, so everybody out there, if you're pregnant or you know somebody that's pregnant, we really recommend perineal massage. It's not a guarantee that you won't tear, but it may help. And
And I've got a post about it on my page.
What's the downside? Oh, there's a post on your page. Yes.
Exactly. Yeah.
Okay, so I'll link that here too. And everybody, thank you so much for joining us. Midwife Marley, I really appreciate your time. You are needed elsewhere right now, and we'll do it sometime. And I loved hearing about your experiences, and it's so different comparing.
It is.
Even just across the pond, right? So
it's brilliant, isn't it?
Yep. All right.
Well, thank you very much for having me. You take care,
everybody. Bye-bye.
Bye. Bye-bye.